Gina, it may feel like the pandemic has put life on hold, but there are still critical needs that have to be met. I spoke with Chelsea Smith, Outreach and Communications Coordinator for the Community Blood Center, to learn how we can help in a safe way. So Chelsea, we know that having a decent and fulfilling blood supply is critical. What's the current status?
Yeah, the current status isn't good, but it's also nothing new. So we've been in a blood shortage since March, since the onset of this pandemic. We typically like to have a 7-day supply of blood products on the shelf at all times. And unfortunately, we've not exceeded a 4-day supply since March. Today, when we took a look at our inventory, we saw that we were sitting at a 4-day supply, which is an increase from previous days. We've been around a 2 to 3 day supply. So it's good to see we're up at that 4, but we really need to get back to that 7-day supply to be comfortable.
All right, and for anyone who's watching, when we say that 4-day supply, if there were an incident where maybe you had to give out a lot of blood or a lot of people needed it, does that mean we would be in trouble?
Yeah, absolutely it does. That means that we would have to borrow blood from other centers. So our hospitals have standing orders with us for the amount of blood products that they typically use in a given day at their hospital. And unfortunately, if we don't have that 7-day supply, we don't really have much cushion beyond what we're already supplying our hospitals with. So if, God forbid, there was a pileup on the highway or some mass casualty incident where we are requiring a lot of blood products to be sent to a specific hospital, it would severely deplete what we've got on hand and would require us to have to reach out to our partners in other parts of the country because we don't have a stable blood supply right now.
That's a problem. Hopefully people are listening and they want to help. How can they do that?
The most effective way they can help us is just to donate blood. We can't come to you, so it's not as easy as you getting up from your work desk and walking down the hall to donate blood. We now need you to come find us. And unfortunately, that's been our main challenge through all of this, is that we're not really seeing the gap close there.
So what precautions are being taken at the donor centers and at the blood drives to ensure safety?
In general, what you can expect when you arrive at any blood donation site is that masks are worn by staff and donors at all times. Temperatures are checked at the door. Social distancing protocols remain in place. So all chairs, all beds are spaced at least 6 feet apart, more if we can afford that. We're also initiating a lot of COVID screening questions. So, of course, if you're experiencing symptoms of any illness, you're not permitted to donate. We ask that you not arrive, but we do ask specific questions related to COVID to ensure that we're allowing people into our donor centers in a safe manner.
And Chelsea, you mentioned several donor centers. Where are they located?
Yeah, we've got 7 donor centers located across the metro, 1 in Blue Springs, 1 in Gladstone. We've got our headquarters center here in Kansas City at 4040 Main. We have 1 out in Olathe. We have 1 in Overland Park. And then we've got Topeka and St. Joseph as well.
Many locations for you to donate. For more information on how you can help, call 877-468-6844 or go online to savealifenow.org.